Hi, my name is Elise Brevik, and I'm going to be talking about the effects of sensory integration on the development of fine motor abilities. Occupational therapists recognize sensory integration, or SI, as the process by which an individual takes in sensory information, organizes that information, and then determines an appropriate response to that information. So there are three core types of sensory integration, and those are proprioceptive, vestibular, and tactile. And for my study, I focused primarily on proprioceptive and vestibular sensory integration interventions. There were several studies in line with what I was looking at. However, these two specifically stood out to me. They found that sensory integration intervention was an effective treatment that allowed children to find more independence when completing activities of daily living. And they also found that that it helped to stabilize children and help them learn activities of daily living as efficiently as possible. And then this study also furthered the notion that sensory integration is a beneficial form of treatment by specifying that vestibular sensory input and sensory integration was allowed. It had allowed for improved time of completion for fine motor tasks, and it also helped improve focus, postural control, and also strengthen trunk and neck muscles. So the purpose of my study was to compare proprioceptive sensory integration and vestibular SI to interventions to see which type of intervention would result in faster completion of a fine motor task. And I thought that vestibular concurrent sensory integration intervention would actually be the most beneficial for the child. The child was 3 years and 4 months old. He was a male and he had no diagnosis. However, he did display some self-stimulatory behaviors that made the therapist think that possibly he did have autism. The setting was a pediatric therapy clinic, and it was in a gym, a therapy gym specifically. The research design was an A-B design, and the dependent variable was the time to complete the task, and the independent variable was the time, the type of concurrent sensory integration intervention that was received, either vestibular or proprioceptive. So there were two different types of procedures that went on. The first being the vestibular sensory integration intervention. So there was an initial task model for both proprioceptive and vestibular sensory integration intervention, where the therapist would take a 1-inch wooden bead and put it on a hard tip string and show the child how to do it. And then we would give it to the child and say, okay, now it's your turn. And that is when we would start to collect the baseline data for both vestibular and proprioceptive sensory integration intervention. He would try to string the beads on with as little assistance as possible. However, we would intervene and record that information using the FIM, which I will get into later on. After the baseline data was collected, we did 3 minutes of vestibular sensory integration intervention with the swing that you can see in the top left corner, or the child was given a weighted vest, which you can see in the top right corner. And then he would wear that or be swinging for 3 minutes. After that, he would be asked to attempt again. So he would do the task of stringing 3 1-inch wooden beads onto a hard tip string. He would do that task while receiving the sensory input. So he was constantly integrating that sensory information, because we can't control how much sensory input or how little sensory input he was receiving prior to coming to therapy. So this was a way to kind of control for those extra variables. So here are the results. As you can see, it took him 1 minute and 58 seconds for the baseline for on the left for the vestibular sensory integration intervention. It took him 1 minute and 58 seconds and on average. And then after, when he was receiving concurrent sensory integration while swinging, it only took him 55 seconds, and that's 1 minute and 3 second difference. And then on the right shows the concurrent proprioceptive sensory integration against baseline. Baseline for this one was on average 1 minute and 37 seconds, and the concurrent sensory integration intervention for proprioceptive was 1 minute and 12 seconds. So he did improve overall for both baseline and overall for sensory integration intervention, regardless of what type of sensory integration it was. However, vestibular sensory integration did, the input from that was resulting in a faster task completion time for this specific task. When he did need assistance, we would measure that using the functional independence measure, or the FIM, as I stated earlier. And at the beginning, during his initial evaluation in July with a therapist, he needed total assistance to do this task. He was unable to string the bead at all. During our first trial, he actually needed maximum assistance, helping because he really had difficulties motor planning and turning over the bead to pull the string through. But by the end, he needed minimum assistance and was able to do at least 75% of the task on his own. Maybe was just a little bit of attention, like help getting back on track. But other than that, he was really able to do it, and he improved his time over both the baseline and over the sensory integration intervention. Some limitations were the COVID-19 protocol, of course, and then also he was being seen for other practices. It would have been beneficial if the research was the only practice that he was receiving. And for future directions, I do hope that we can maybe look into sensory integration on fine motor skills with a larger group, and specifically with participants with similar diagnoses, and then also investigate sensory integration intervention on fine motor tasks or multiple fine motor tasks. So that is my presentation, and thank you so much. Here are the references, and I hope you have a great day. Bye.